Thank you, Dr. Gottesheim, for sharing images of your surgery. We're going to turn them into a mini educational video. Doctor submitted photographs, DICOM, and digital impressions to Roe for workup of a chrome case. We spent the next 5 days preparing for the online meeting, which we're going to share with you. Want to share the workup on BlueSky Software here. This is the mandibular plan, obviously in the bottom right here, and in the top right. I want you to notice, please, how we're going to have angled implants. So this patient's going to have 6 implants, but the middle 2 are at an angle. I'll show you a little different view here. The bone off. So this would have been an all-on-4 configuration in the anterior, but then just for stability and to avoid cantilevers and give some more support to the prosthetic, decided to add implants in the posterior as well. In the maxilla, there's going to be a couple of challenges in surgery. You can see in the top right corner here, this implant is going into the sinus, and there's limited amount of bone, but hopefully the doctor gets stability. That's the goal. You can see here in the top left into the sinus, top right into the sinus, and this will be a 6 implant arch as well. I'll show you a couple different views, all the different surfaces and layers that we have to put into the software to make this work. The blue and the green are proposed setup areas. Setup files from all designed from a SMILE simulation. And once the online meeting is completed, then we fabricate chrome for surgery. And I'll show you some of the different layers here. So these are just obviously the pre-op models and not in occlusion. This is not in the correct bite. We design these arches independently. And here are the fixation bases for bone reduction. And we'll remove some layers here to show you the volume of bone to be reduced. On top of that is the pin guide for supporting the prosthetic. On top of that is the osteotomy guides. Here you can see the bone reduction with the osteotomy guide in place. And then finally the new prosthetic teeth. Again, all designed from the SMILE simulation even before we got started on the case. Patient and doctor approved the SMILE simulation. And then finally the pin guides for delivery of the fixation base. We'll share some images of the day of surgery. You can see the exposure of the sinus on the patient's right, and I believe on the left as well coming up. But on the bottom image, you can see the pin guide is delivered and verified that there's a complete seat, a full seat with the windows in the anterior. The fixation base has been seated, and anything above the fixation base in the maxilla below is going to be reduced. So that's the bone reduction line, and the bottom left image is the carrier guide that's seated early just to make sure bone reduction has been achieved. The carrier guide can be removed and reseated until bone reduction is 100% accomplished. And on the bottom right side, the prosthetic can even be seated just to ensure that that occlusion is correct. Now this is a double arch case, so it can be a little deceiving, but it's a nice test anyway. Top images are the osteotomy guide and sites being drilled. And on the lower, you can see both implants were used and placed in the sinus, and you'll see in subsequent images that they were used for supporting the prosthetic. Top left, the blockout gaskets were used, and as you can see, not all the implants were utilized. The maxillary prosthetic was inserted and then moved to the lower arch, where not all the implants were utilized again for the prosthetic, but they were placed to be picked up later. And the final result. Nice job, Dr. Gottesheim and Rick. Thank you very much for watching.